And if you're confused whether to get a vaccine or have your child receive a vaccine, you're not alone. Many people are confused about what the current vaccination guidance is and expect even more confusion in the weeks to come. Scripps News Deputy Political Director Joe St. George explains the additional changes a newly formed vaccine advisory panel will soon make.
Secretary Robert F. Kennedy Jr. has instituted a host of reforms since being picked by President Trump to lead the Department of Health and Human Services, with much of his controversial changes centering around vaccines. Since taking office, Kennedy has removed 17 members of the influential Advisory Committee on Immunization Practices. He has since appointed 12 new members who are set to meet for the first time as a group publicly on Thursday. The new members include a host of medical professionals who have been skeptical of past vaccine practices. Now, before we go any further, we should talk about why this vaccine committee matters in the first place. You see, it advises the CDC on what, when, and how often vaccines should be administered. And while the CDC has final say, it can impact which vaccines are free or covered by insurance. It can also impact what pediatricians tell their patients.
The committee that's formed right now is not a committee that I am looking to for vaccine recommendations as a pediatrician.
Dr. David Higgins is a pediatrician with the University of Colorado Anschutz Medical Campus. He says Kennedy's reforms thus far have created division and frustration within the medical community, leading to many doctors now seeking vaccine guidance elsewhere. Higgins says this is also resulting in confused patients and parents.
I empathize with a parent who says, I'm really confused. So I encourage parents to first try to talk to their child's pediatrician.
A recent study by KFF and the Washington Post found that about 1 in 6 parents, around 16%, have delayed or skipped at least one vaccine for their children. Kennedy explained his vaccine position to Congress in early September.
I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations, and the same is true with vaccines.
Among the vaccine changes possible this week include a change in guidance on when to administer the hepatitis B vaccine. For more than 30 years, the CDC has advised infants receive their first hepatitis B shot at birth. Joe St. George, Scripps News Group, Washington.